If you're a physiotherapist or massage therapist, this video is a complete compilation of powerful myofascial release techniques targeting common areas of tension like the psoas, quadratus lumborum, neck, and shoulder. Each technique is demonstrated step by step so you can start applying them confidently in your practice. From deep tissue anchoring to ischemic compression and positional release, don't skip a second, because the final technique might just be the one your patient needs most. In this treatment, we simulate a myofascial release technique for a patient with tension on the left iliopsoas. First, we position our fingers at the level of the left anterior superior iliac spine without pressing toward the abdominal region. Instead, we anchor, forming a sort of hook with our fingers, like this. This allows us to feel the psoas tension. Now we press internally with our hands, using one or two hands depending on your preference. The goal is to apply gentle pressure against the muscle tension and then slowly release. If we want to perform an ischemic compression, it's best to move to the opposite side of the table. This way we can use both thumbs to apply pressure directly onto the psoas trigger points we find. This approach is often used to treat low back pain. An alternative is the restraint technique. We use the edge of our hand, place it medially on the ala of ilium, and apply a quick frictional movement in this direction. The third technique is the muscle energy technique. Place the patient in sideline position. The bottom knee stays fixed to prevent compensatory movements. Since the psoas flexes the hip, we need to extend it to stretch it. With one hand, we block the posterior part of the hip. With the other, we hold the upper leg. Ask the patient to flex the hip against your resistance. Hold for a few seconds, then ask them to inhale. As they exhale, slowly push the hip into extension. Repeat this 3 to 4 times before relaxing. The final technique is positional release. The patient is lying supine. We support the leg and with the other hand apply gentle pressure on the tense psoas. While maintaining that pressure, we shorten the muscle by slowly flexing the hip, holding that position for a few seconds to allow the tissue to release. Because the QL helps with lumbar extension, we start the treatment with the lumbar spine in a slight lordotic position. To treat it manually, use one or both hands, overlapping them for more control. Start from the lumbosacral area and ask the patient to posteriorly tilt the pelvis. As they do, glide your hands along the QL fibers. Another option, approach from the rib side. This puts you right on the lateral edge of the QL. If you feel a trigger point, hold pressure for ischemic compression to deactivate it. Another tip, since space is tight in this region, ask the patient to raise their arm overhead. This opens up the side and gives you better access to the QL. Want even deeper release? Try this. Have the patient lift one leg and hold it for 10 seconds. This activates the QL, and when they relax, the muscle is inhibited and easier to treat. You can also ask them to lower the leg off the couch slowly, doing an eccentric contraction, while you continue gliding through the muscle fibers. Or ask for a gentle downward push with the leg, which also helps inhibit the QL and lets you reach it more easily. Let me know in the comments, have you ever tried treating the QL this way? Don't forget to like this video, share it with your colleagues, subscribe to the channel and leave a comment below. In this video, we'll look at myofascial techniques for the supraspinatus. This muscle originates from the supraspinous fossa of the scapula and inserts on the superior facet of the greater tubercle of the humerus. Its primary action is to initiate the abduction of the arm, and it's the muscle most commonly responsible for shoulder pain. We'll use a little bit of cream, just a small amount, and apply it directly onto the supraspinous fossa. We don't want the area to be too shiny, because in that case your fingers will slip. The first thing we need to do is find the spine of the scapula. Once that's located, I can control the arm, and with 2 or 3 fingers I can start massaging the supraspinatus while controlling the abduction movement. This creates a passive movement that improves the effect of the technique. An even more effective approach is to ask the patient to slowly lower the arm. By doing so, we inhibit the supraspinatus, which now works eccentrically to lengthen during the movement. This allows us to glide through the muscle more easily with our fingers. If I ask the patient to hold their arm in place, we're creating an isometric contraction, and if they hold it for around 10 seconds, we can take advantage of what's called a post-isometric relaxation. That gives us a window of about 25 seconds where we can glide through the supraspinatus muscle much more easily, and this works really well. This is a safe, effective and highly targeted technique to treat one of the most important muscles in the shoulder, especially useful for patients with shoulder pain. So let me know in the comments if you ever treated the supraspinatus this way and how it worked for you. The sternocleidomastoid, or SCM, originates from 2 points: the manubrium of the sternum and the medial portion of the clavicle. From there, it runs diagonally across the side of the neck and inserts at the mastoid process, right behind the ear on the temporal bone of the skull. To locate this muscle on your patient, ask them to gently flex the head forward or rotate it to one side. For example, in this case, when she rotates to the right, the left SCM contracts, because it's responsible for rotating the head to the opposite side. I place my elbow on the opposite shoulder and support the patient's head with my other hand. This gives me good control over the movement. I can guide the head rotation myself or ask the patient to help with the movement. Then, with my free hand, I begin working on the SCM, gently massaging it from the side while it's contracting. We use a soft grip and avoid pressing too hard, especially on the front of the neck. From the mastoid process, I slowly glide down along the muscle fibers. Then I go back up, gliding down and back up in a slow, controlled motion. As the patient rotates their head, my hand naturally changes position, and that's completely normal. Just make sure to avoid putting too much pressure on the neurovascular bundle. While gliding down, I can also assist the rotation or gently flex the head forward. This lets me reach different fibers of the SCM. If I do the movement passively, meaning I control the rotation, the patient stays more relaxed, and I can fine-tune the speed, depth and direction of my myofascial release. For deeper release, try this. Ask the patient to rotate their head to the right and gently resist your hand for about 10 seconds, creating a light isometric contraction. Then ask them to take a deep breath in, and as they exhale, you slowly glide down to the SCM. taking advantage of the natural relaxation that follows. This is a safe, effective, and highly targeted technique to treat one of the most important muscles in the neck. Let me know in the comments if you ever tried treating the SCM this way and how it worked for you. If you want to keep learning, click on the related videos or visit our channel to explore more techniques and tutorials on manual therapy. Don't forget to like this video, share it with your colleagues, subscribe to the channel, and before you go, click the link in the description to discover our complete video courses and take your skills to the next level. Thanks for watching and see you in the next video.